when about 2 years ago, almost actually, it's almost the anniversary of 2 years ago, I almost died. Um, I woke up with a really severe post-operative infection 12 hours after a procedure that was supposed to be recoverable in 1 hour. It was outpatient. I went home. I was a little tired. Took some ibuprofen. I went to bed. I woke up and I had the worst pain I've ever had in my life. And after this infection, I actually had 4 more surgical procedures due to it. So that infection was still the worst pain I ever had in my life. I crawled to the toilet thinking I was going to vomit. I passed out. I crawled back to my bed. I woke up a few minutes later. I crawled back to the toilet, and my husband was watching me. And generally, throughout my life, people think I'm just overreacting because I have um, strong reactions to things. And he followed me to the bathroom, and as I was crawling, and he's like, "What are you doing?" I was like, "I'm gonna throw up," but I couldn't talk. I was slurring my speech, and I thought, "Oh my gosh, I'm having a stroke or an aneurysm or something." And I tried to throw up, and I couldn't throw up because, fact, I can't throw up. It's it's pretty crappy. I don't recommend it. Um, anyway, so I get to the toilet and I fall over into my laundry in the closet in my linen pile, and he's like, the next thing I remember, he was shaking me and he's like, "Are you okay?" And he's freaking out and takes me, he took me to the ER. They did not give me any pain medication. They just kept me for 3 hours and observed me, even though I couldn't speak. I was slurring my speech. They couldn't get a hold of my doctor who had done a procedure the day before. They sent me home. So I get home, I get in bed. A few minutes later, my husband comes to check on me, and I have a fever of 105. He's got my doctor on the phone. She's freaking out. Says, "Get her back to the hospital now." And they put me in the hospital. They admit me right away. And I stayed there for 3 days. It took them another 4 hours to give me any pain medication. I was crying the entire time, and the pain medication they gave me didn't work. I was on, they gave me Percocet, Dilaudid. They put me ultimately on a morphine drip and were alternating it with a couple of other things. Probably Shireen could tell you about this stuff because she's super brainy when it comes to nursing. And God, so many other things. It's creepy. She should really get stupider. Anyway, so I'm in the hospital. I'm on heroic doses of, I think there were 4 different drips, 2 of which were antibiotics, and then there was the morphine pump. So I was on these amazingly high doses of antibiotics. They're trying to fight the infection. They won't tell me anything. My blood pressure, I looked at it, and the top number was 43, and the nurses kept telling me, "I can't believe that you're conscious." So they're checking me every 15 minutes, waking me up every 15 minutes. I keep passing out. And on the second night, I had a hallucination or a dream or something that one of the nurses, the one I didn't like, was wheeling my bed through the wall, and I was going head first through the wall, laying down, and I was screaming at her to stop, and she kept flickering into an evil clown. I was screaming at her to stop, and that I didn't want to go, but I could see behind me was a big warm light, and it was very peaceful. And I had told myself when I went into the hospital, I'm not gonna die, because I was in so much pain. I thought I really might die. I'm not gonna die. And she's wheeling me toward this light, and I'm like, "No, you can't do this. I am not going." And I started screaming for help, and the nurses came running in, and there were things beeping, and they started shaking me, and I woke up, but my blood pressure was still insanely low, and I was still feverish and everything. But I came back, and they after that they continued. They were seeing me every 10 minutes at that point, and they never told me what was wrong. It turns out, I found out I was septic, and I was actually at risk of dying. and they didn't tell me, and they didn't tell anyone in my family, so nobody knew that I was in serious condition. They just knew that I needed to be on antibiotics and that I was dehydrated. That's what we were told. So finally, on the third day, a nurse came in and shouted at me. And her purpose in doing that, like, it was actually purposeful. She was shouting at me and she kept looking at my vitals, and she was trying to get my blood pressure to go up because they wanted me to leave. They needed a space. They needed a space in the hospital. So my blood pressure did end up going up. The top number went up to 80. And then slowly over the rest of the day, it got up to 93, which was my normal top number. It was usually like 90 over 60 at that point in my life, which was, I don't know why. It was always on the low side of normal. Anyway, this is getting pretty long, but the point is, she got my blood pressure up and they sent me home. And fortunately, I was okay after that, if you consider having to have 4 more surgeries. Okay. That's my interesting story. Bye.